Hi, I'm David. I'm an activity worker at the Harplands and I've worked in combined healthcare for 30 years.
My name is Dr. Qasim Mirza, and I've been working in the NHS for the last 28 years.
Hi, my name's Diane Daly. I work for the ARS team, mental health. I'm an STR worker and I've worked for the NHS for 25 years.
Hi, I'm Phil. I'm a social worker in the Trust and I work for the Autism Assessment team. I've worked for the NHS for around 35 years now. It's amazing where that time's gone.
Hi, my name is Angela Licata. I'm a medical secretary and I work at the Darwin Centre and I've worked for the NHS for 40 years.
Hi, I'm Anne Melville, Head of Facilities, and I've worked in the NHS now for just over 45 years. Come July, I will have done 46 years.
Why did I join the NHS? Well, it's a bit of a strange one, that, because I work for the local authority in social care. And so it's part of the integration process of mental health social workers moving into the NHS and working collaboratively. So that kind of happened over the course of a year.
I joined the NHS because I wanted to make a difference to people's lives.
I joined the NHS because I was a service user at Wall Lane House for over a year when I was 15 to 16 years old. And I went to a careers advice workshop at, I think it was Unity House. And they advised if you went into the caring profession, and I did a work experience. And I did my qualifications once leaving and then started my student nursing when I was 18.
I joined because I wanted to be a nurse, but my mum put me off completely, saying all sorts of horrible things that I would have to do as a nurse. So I thought the next best thing was being a medical secretary. So I went to college and trained as a medical secretary.
Came from Pakistan because I wanted to have higher training in psychiatry. And obviously I became a member of NHS. I joined NHS and I'm very proud of it.
Can I remember my first day in the NHS?
My first day working in the NHS, I remember feeling really nervous. I had butterflies in my stomach.
It's been 28 years, but I can still remember the first time when I was going to the hospital on my first day. I was received at the reception by one of the medical staffing because I was new to the country and I had joined in the middle of a rotation. And I shadowed one of the junior doctors on my first day. We went to our ward where I was supposed to work.
And I can see the manager now, and her name was Jock Miller. I can see her now, and she offered me a cup of tea. And I was so fearful at that day that I drank a cup of tea, and I never ever drink tea, and I still don't to this day.
I do remember meeting the community psychiatric nurses who we were working alongside in those days, and there was a bit of like a kind of courtship dance, really getting to know each other. But I think what kind of struck us all soon was how we kind of put the people we were serving really at the centre of what we did, and that was what was driving us all.
When I first joined the NHS, when I was a supervisor at the Royal Infirmary, on a Monday morning, one of my jobs was to walk down to the Limes at that time and to take the clock cards. And who would be in the office to receive the clock cards but Steve Blaze? And here I am today, working with Steve Blaze very closely on Project Chrysalis.
What is my proudest moment working in the NHS?
Generally speaking, whenever I have made any positive change in a patient's life, either through direct clinical care or through a team, as a member of the team.
I think my proudest moment was when I was a student. I actually did a placement on Wall Lane House as a student. I think I was 20, so I'd been a service user, a patient there when I was 16, so that was quite a big moment for me to actually get to that point.
On instinct, I hadn't seen a patient. Nobody had slapped eyes on the patient for a few days. So I spoke to my manager and asked them if I could go and do a wellbeing check. Phoned the patient, didn't answer. So the patient has got a very low letterbox. So I knelt down below eye level, shouted through the letterbox her name, and they shouted back, "I'm stuck in the bath." So I phoned the relevant people because obviously the patient was talking to me, so I knew she was safe, and got the police to come out, and then I waited for the ambulance until I could leave, until the patient was safely on her way to hospital.
What's changed during my time in the NHS?
People could smoke in the offices when I first started.
From the start of my career, it was that kind of shift away from people in long stay psychiatric hospitals and institutions to having their care needs met in the community.
So I've seen many changes. I've seen hospitals closed. I worked at Biddulph Grange. That closed while I was there. I've worked at Fanny Deakin. That's closed.
It's like we have moved on from pen and paper to the electronic system. Obviously, like, things were a bit difficult and we struggled with it in the beginning. But now it seems like we are getting on fairly well with the system, and we hope that this system is going to improve further in the future.
The biggest thing throughout my career is noticing that there's less side effects now from the antidepressants and the antipsychotic medication.
The other significant thing was the notion of recovery and that becoming embedded, particularly in kind of mental health work, where people are not defined by their mental illness, that people can actually recover, they can actually get better, and they can actually kind of find ways of living with their mental health needs.
Getting jobs has changed. When I joined the NHS, it was who you knew. So if the manager knew that you wanted a job, they would get you that job. Whereas now everything has to be advertised and you have to go through an interview process. So that was really, really different.
The other big change as well, which I'm kind of quite proud of, is social work, social care becoming a key profession in the NHS.
Why is the NHS so special to me?
It's one of the few healthcare organizations in the world which provide free healthcare to the patients, and the healthcare is provided on the basis of needs rather than the patient's ability to pay.
The NHS is so special to me because it is the best that I think the country has to offer, in the sense that it's got the best standards, it's got anything that you need to fall back upon, you can rely upon it, and it's like there in the background doing its thing, but when you need it, you desperately need it, it's there for you.
NHS is, I would say, it's the jewel in the crown.
The NHS is special to me because I find it's like a family.
Well, it's always been there, obviously all my life since I was a child. It's free to at point of access to anybody.
At its heart, there's just this kind of constant, and that's the dedication of its staff and those NHS values. It really is remarkable.